Welcome to the Doctor's Life Podcast with Diane Ansari Wynn, MD. Dr. Diane is a stress and burnout coach for doctors. With her 15 years of experience as an anesthesiologist and certification as a physician development coach, Dr. Diane coaches doctors on how to live a rich life of purpose, fulfillment, freedom, and happiness both at work and at home. In this podcast, Dr. Diane brings together doctors and researchers that are experts in health, wellness, stress, and burnout, as well as doctors that have been successful in clinical practice, academics, non-clinical careers, and business to share their expertise and life experience so that you can live your own life purpose, fulfillment, freedom, and happiness. To get free access to a PDF and video of easy and proven strategies that melt stress away and keep it away, simply register at www.dianeansari-win.com. That's www.dianeansari-winn.com. Now here is your host, Dr. Diane Ansari Wynn.
Hi, it's Dr. Diane here, and I have a quick request before we jump into the show. If you like this podcast, it would mean so much if you took just a moment to hop over to iTunes, write a review, and rate the show. That is how other people will find the show and get the same great value from it that I hope that you're getting. It just takes a few moments to click a star rating and write a quick note. Now, on to the show. Today's guest on the Doctor's Life podcast is Dr. Stephen Beeson. Dr. Stephen Beeson is a nationally recognized author, physician, and speaker who has provided tools and tactics for engaging and training physicians for hundreds of medical groups and hospitals throughout the country. He's a board-certified family medicine physician, and during his tenure with the Sharp Reese Steele Medical Group in San Diego County, he was chosen by the leadership to be the physician director for the Sharp Experience, which was an organizational commitment to service and operational excellence. During that time, the medical group improved their patient satisfaction from the bottom to the top decile, and they won 3 AMGA Acclaim Honoree Awards for clinical performance. And with Sharp Healthcare was recipient of the 2007 Malcom Baldrige Award. He has written 2 books on physician involvement in organizational change, and most recently, Dr. Beeson founded the Physician Effectiveness Project at practicingexcellence.com. Welcome to the Doctor's Life podcast. So happy to have you on our show today.
No, I'm delighted to be here.
First off, I like all the docs that I interview to tell us about themselves. I'm so interested in everybody's journey into medicine. And so tell us how you got interested in medicine and your path to where you are now.
No, it's an interesting story. I mean, everybody's got an interesting story, but born and raised in San Diego, actually born in Sharp Hospital, the place that I still am affiliated with. And,
oh, my goodness.
Yeah, so went to undergraduate medical school and residency at University of California, San Diego. And the kids go to the same high school that I went to in Poway, and that's where I'm sitting right now doing this podcast. So true San Diegan, and really, for most of my young life, wanted to be a musician. I was a trumpet player in a high school band at junior high, and all the way through high school, thinking that's what I wanted to do. My parents were delighted, as you can imagine. And,
right?
Yeah, and I have an uncle.
You go be a starving artist.
Yeah. So I have an uncle who's a neurologist, and I remember the night that we got together. He's from now in Chicago, in fact, and does a lot of headache work, and he's a avid neuroanatomist and teaches anatomy at the medical school, and he's a wonderful, amazing guy. And we had dinner together, and he told me about a day in the life of a physician, him in particular, and I just decided then, and I was beginning to wonder if music was really a way to actually make a living. I mean, many can, but they're far more talented than I am. And he got me some opportunities to work with him, to round with him. I traveled at that time. He was in Ohio, and I got some amazing exposures and experiences. And I pivoted literally that night I made a life choice to go from music to medicine. And
wow.
people say, God, what a crazy pivot, but it's not really all that different. It's instead of kind of etudes and technical studies, you're doing biochemistry and anatomy, but it's a pursuit of mastery to accomplish a set of skills to go do something,
exactly.
both of which are really hard.
Both of which are really hard.
That's how it all happened.
Yeah, that's really interesting. So how old were you when that happened?
I was 17.
17, yeah. There's another interviewee that I have on the podcast, and we talked briefly about mentoring because he's Dr. Roger Washington. He's a sleep expert in Santa Clara, California. Wrote a book about sleep, and he's my cousin, and he mentored me into medicine. So I just think it's amazing, just watching him. I remember he took me, he's working in an urgent care, and he just had me hang out with him during the day and see what he did, what his life was like, and that really turned my head, So I think mentoring's so important.
Yeah, you wonder why we don't do a little bit more of it in healthcare as new physicians join to be mentored. And if you look at the literature on mentorship, it certainly helps the mentor, but it helps the mentee equally and reduces attrition to almost zero. And, I still play tennis with the guy that mentored me as part of our medical group from back in 1994. So, we have mentorship as a part of our group culture. So it's a great, just one more avenue to help and support physicians to.
Right. Hey, just another project we could add on to. But hopefully our listeners are getting this and they can might make a decision to mentor somebody. It's so important. So you decided to go into medicine, and then went to med school, family practice, residency, and then.
Yeah, I joined the Sharpey-Steele Medical Group in 1994 in July, and was really just full time, all day, every day, seeing patients, growing my practice, learning. I got involved with physician leadership development, coaching, training around 2001. I was selected, appointed, sentenced, depending on how you position, with a physician lead position for an organizational change effort we call the Sharp Experience. And at that time, our physicians were struggling a bit. It's an immensely competitive environment here in San Diego, a lot of at-risk dollars and how the commercial payers pay and reimburse healthcare. And we have very good healthcare systems literally on the same block. And so we were, physicians in particular, were in the bottom decile regarding patient experience. And, there were market share threats, there were pay-for-performance losses, and even physician attrition issues just based upon some cultural conditions of our medical group. And I think the Sharp Experience was a full-on dedicated effort to change how it was for our clinicians, how it was for the staff that are part of our team, and how it was for the patients. And I was selected to be the physician director of the Sharp Experience. So that's really where my role began in physician coaching, training, and development.
Mm-hmm. So was the Sharp Experience then a multidisciplinary approach to creating change within the practice and for the patients and the docs?
Yes. It very much was designed to address all parts of the healthcare team, including the patient. But to be totally honest, when it first launched, it had a fairly weak physician arm, and it almost appeared and operated as though it was an administrative activity. And in fact, we launched the Sharp Experience and didn't do a deliberate outreach or co-design with our physicians, and realized about a year into the launch of the Sharp Experience, where it was sputtering a bit, that it would probably have greater capacitation if the leaders of the healthcare team were actually participating. And we thought and reflected, gosh, it would be nice if physicians, teams, nursing, administration were lockstep with each other, moving together. And that was, even though we didn't quite articulate it like that, that was really part of the effort of getting a physician lead to help bring and unify the team, so it did become multidisciplinary and not, this is what administration is doing and the doctors are going go do their own thing, which is kind of how it was initially.
Yeah, yeah. So would you say, at least for the doctor's piece of it, that was almost like a turning point in the? Or
No, it was a big shift when you look at the clinical microsystem environment. You know, the small teams that are providing care directly, the motor end plate of healthcare. Those people, how they do things and how they show up, how they interact with each other and how they interact with patients is highly influenced by the example that is set by the clinician. So when the physician is team leader, not as a team leader like little minions go do what I tell you to do, but a team leader in terms of building common ground, building team intelligence, honoring and respecting each other, trusting each other, and leading efforts by example. When you inoculate an organization with physicians that are doing that kind of composite of things, you can really rip it. I mean, you can really get things going and rolling. The idea was, how do we help physicians begin to lead their teams locally, and how do we help physicians do the things that are really important in regards to how patients define great care? And a lot of my observations, believe me, I was so green when I began this. I was in that category. I didn't know what I didn't know. And it became very apparent to me over my first 2 to 3 years of this responsibility of coaching, training, enrolling, and engaging physicians. My observations were, physicians who were struggling were not doing it intentionally. It was not a malicious act. And number 2, many of them didn't even know that they were even doing it. And number 3, it was often heartbreaking for physicians to hear that patients didn't understand them, didn't trust them, and wouldn't recommend them to other people. And I got to tell you, when I first began individual physician coaching, that was one of the things that we had done. We had done group coaching, integrated coaching. I mean, it's an ongoing process that's as vibrant today as it was back then. But when I would meet with physicians, if they met certain criteria, we would meet with them one-on-one. I got to say, a third of them were in tears. I mean, and I thought to myself, I said, we can't hold physicians accountable for stuff that they've never learned or know how to do.
Exactly.
So, and so I really, this is very much see one, do one, teach one sort of thing.
That's how a lot of things are, in our physician development, that, you don't have to be the expert right off. You just somehow get the responsibility and you learn as you go. And
I got to tell you, I was 1 month ahead of these people, these physicians, where, for example, if we were to be coaching and training physicians on a certain domain of patient interactivity, explaining things in a way that the patient could understand, I would look, read, listen, and identify and test in my own clinical environment what are the things that we can provide to patients about a diagnosis that has them walking out knowing, I know what I have, I know what I'm supposed to do, I know what's going to be coming next, and I know what to look out for. And to sort of build that as a rubric, so we have, just like we've got post-operative DVT prophylaxis clinical guidelines, when we have how do we explain a diagnosis to a patient? If you think clinical variation is a big deal, wait till you see behavioral variation. We are all over the place. And so what I learned is that there's simple things that we can do, learn, and practice. And I had my own laboratory, which is my own practice. So I would learn these things. I would try these things. I would ask patients how it worked for them. And I began to log and register the things that were working well. And then I would take that composite and I would take it and transfer it to others and allow physicians to go through the vital toll booth. The people always ask, what are the things that really work in coaching? Is when a physician tries a particular skill and they see the benefits in terms of what happens when they do it, that is the toll booth we want them to go through. We want them to explain a medication or explain a diagnosis or express empathy or do shared, there's thousands of skills that make for really, really great clinicians. Whatever the thing is that they're working on, and the patient goes, man, that was, that was unbelievable. And we need to see, feel, and experience that. And when a physician goes through that experience, then not only do they continue to do that, but then they become an ambassador for that thing to others. They said, here's what I tried, here's what I did, here's what the patient, and then you create this learning environment, this idea exchange environment, and you've just inoculated it. You just dropped in a particular skill, and you've tasked the physicians to identifying what happened when they tried it, and you tasked them with sharing it with others. So that's how you can get some of the scalability and the spread of the things that work.
Oh, that's it. Yeah, that I was wondering about that, so I'm glad that you explained that, because I think you brought out some really important points, including that we as physicians, we want to be good at what we do, and that if not only being able to identify disease and pathophysiology and do a good clinical exam, et cetera, but also everything that encompasses being a good physician. That's what all of us, I believe, truly want. And to be able to provide those skills, it's just natural because we like to teach too. So it's just natural that we would want to share with each other. So we appreciate everything that you were able to develop. And it wasn't only just appreciated by the docs and the patients, but you received a Malcom Baldrige National Quality Award for your work, which is a big deal.
I was just one member of a big, gigantic, very capable team.
I was curious, did you find you had better quality measures? What other measures did you vastly improve upon?
Patient experience, kind of the nadir for the physician composite, we were at the 6th percentile at one point, and we were able to achieve the 91st percentile, and that's a pretty big move for a large multiplicity group. And for the quality metrics, we became the #1 medical group in the state, which is a ranking of over 230. There's commercial health plans that rate by a variety of criteria. We're consistently top-tier medical group in the quality composites, whether it be diabetes composites or HEDIS criteria. And I think that we also tracked physician engagement longitudinally over time, and we're able to have incremental year-over-year improvements of the physician experience as well, the clinician experience. And, our financial measures, our financial performance was able to notably turn around by our ability to collaborate, partner, establish patient loyalty, marketplace reputation, care coordination, transitions of care, clinical variation reduction, appropriate documentation and clinical documentation, coordination between hospitalists and primary care, reduction of readmissions. All of those were things that you can do when you get people collaborating and dedicated to do what's right and what's best for the patients that we serve together, and that is our common link. And we built that as a sort of a cultural ethic and built selection, orientation, training, measurement processes to help do that. It's a work in progress, despite the fact we've been doing this for 15 years, and I know with certainty that it's still a moment-to-moment, day-to-day effort to maintain a really high-performing group. But the things that really work, not only for the patients, the financial bottom line, the quality metrics, the national recognition, your ability to recruit, but also what it's like to be and play and be a part of a champion. I mean, there's a lot of pride that comes with that. I'm with a group that I'm super proud of. I'm a group that I would recommend without hesitation to my family and my friends. When people approach you and say, what do you do? I'm a physician. Where do you work? Sharpie Steele Medical Group. 15 years ago, I think if somebody said, oh, I got a story to tell, you might wince 15 years ago, not so much now. So we're really proud of what the group has been able to achieve over the years.
Oh, that's amazing. And the great thing about it is that it's not only limited to your group, but that you've been able to share your experiences and what you've learned, not only in 2 books, but you've also developed the Physician Effectiveness Project.
Yeah.
First, I just wanted to quick mention your 2 books. The one is entitled Practicing Excellence, A Physician's Manual to Exceptional Health Care. And then there's the second book, because you took the time, thankfully, to write everything down to help us. The second book is entitled Engaging Physicians, the Manual to Physician Partnership. And we may have time to be able to circle around and discuss those 2 books at length. I just wanted to quickly mention that you can find those on Amazon if you'd like to pick those up. I highly encourage it. And I would love to hear more about your current project, or most recent project, I should say, which is the Physician Effectiveness Project. Can you tell us more about that?
Yeah, no, what I learned and sort of emerging from physicians and how we show up in the clinical environment, how we interact with our patients, how we lead our teams, how we adhere to evidence, how we're stewards of our resources because cost of care is still pretty high, how we're able to participate in the evidence, and our ability to, given that clinicians are 80 cents of every dollar, 90% of all clinical activity, principal drivers of the patient experience, and our behaviors are immensely contagious. If physicians are not in, rolling, going, and contributing to better health care, it's just not going to happen. Looking at talking not only in our group, but with groups across the country, my initial observations of when you ask a physician, how do you run a safety huddle? How do you do a handoff? How do you manage the opioid-seeking patient? How do you deliver bad news? How do you decrease hierarchy in the OR so there's free information transfer and high degrees of trust? Physicians are going to look at you going, some of them know how to do it, but many of us don't. So we wanted to be able to create a repository, a place where all clinicians could go, learn, interact, exchange ideas that could be used as a catalyst to capacitate physicians to go from backseat victim of all the regulatory insanity that's going on in healthcare to front seat innovators, contributors, and becoming the sort of physicians that they hope they would be. And that's really what the Physician Effectiveness Project is. I call it the Khan Academy for Physicians. Plus,
I love it.
Yeah, plus P90X plus LinkedIn. It's got a lot of sort of social learning, idea exchange, programmatic approaches, and we really it's fairly new. It was funded and backed by Sharp, the beneficiaries of physician coaching, training, and development. And its mission really is twofold. Number one is to help physicians contribute to the advancement of healthcare quality and patient-centeredness and care coordination, all the other things that make for good care. And the other, I think, equally and perhaps more important is to restore physician love for the game, because this is the greatest profession there is anywhere, and there's a lot of physicians that are struggling right now. And there's a lot of reasons for that, but I think us collaborating, connecting, and unifying together, being in service of something bigger than ourselves, and helping, supporting, and backing each other and making big-time impact in patients' lives all day, every day, at least is a circumstance that can help restore physician vitality. So that's really the purpose of the project.
Oh, that is amazing. And so the project itself, you're saying it's the Khan Academy, the P90X, and the LinkedIn, all kind of mixed in one. Is that access electronic like Khan Academy?
Yeah, it is designed to fully tap the social network capacities of technology. And it is a web-based platform, and it resides at the public domain is practicingexcellence.com, and people can go and look, see, feel, touch, hear the stories, and get tours of it. But it works like UpToDate, where we consider UpToDate to be the technical repository, and we like to think of ourselves as all the other stuff repository, all the other stuff to make for really good physicians. You're not going to learn how to manage diabetic ketoacidosis in the Physician Effectiveness Project. It's not its purpose. But you do learn skills in the domains of high-performing teams, patient-centeredness, quality and safety behaviors, clinical leadership, as well as our newest track that we're super excited about, which is clinician well-being. And what do we do organizationally as a team and individually to help support physicians' vitality? Oh,
I love that part, specifically being a stress and burnout coach for physicians. Yes. I work with folks more on the one-on-one level, and it's the organizational piece. As you know, there's a substantial research to back that the organization is vitally important for physicians as well. So, you can be great and enthusiastic and come in and feel great, and if everybody around you sort of grumpy and you're not able to pick your schedule and you don't understand the CMR and nobody's there to help you and all of that stuff, it can affect your enthusiasm for the work drastically. And
Yes.
I really appreciate your commitment to helping us all, if we're not vital in our work, become vital in our work again, and stay vital in our work, because I agree with you. It's some of the most important work in the world that can be done.
Yes.
And
Yes.
so I applaud you and your partners and what you're doing. Yes, is that meant for an individual clinician to access, a team leader? Who is
Yes.
like your, someone that would benefit?
Most commonly, it's done as an organizational intervention. We believe strongly in network learning and collaborative learning, and we're all going and moving and doing together, and tapping the technology capability to create synchronous learning and shared scalable learning. So most groups are doing this as an instrument to facilitate a strategic goal. Sometimes it's enhancing patient-centeredness in our culture. Sometimes it's building a high-performing team culture. Sometimes it's a focus on building safety behaviors. There's hundreds and hundreds and hundreds of learning resources inside the project, and we're publishing every week. And they're able to form and create their own learning paths that map to what it is they want to achieve. But the most common structure, even though an individual license, you can get it for just yourself, almost all of them are groups that are doing this together. We help and support the launch and spread and implementation of using the project to help create a pursuit of mastery, continuous improvement learning culture that is designed to help physicians focus on things that we care about.
Right, exactly.
Yeah.
You're working with fairly large groups within the Physician Effectiveness Project.
Yes. We have a group that's onboarding in April. They're bringing on 5,321 clinicians onto the project.
That's fantastic.
Which is, yay, super exciting, gulp. we're super
Well,
pumped.
you're at least 1 month
pumped,
ahead of them.
Right, exactly. I'm living my life in the same pattern, just on the bleeding edge. So we're up at UCSF Fresno campus, and 350 faculty are jumping on the project and looking out for their residents as well. And we want to make as Steve Jobs would say, a dent, and just help doctors not take back medicine like it's a battle, but restore medicine to what we thought we were going to be joining in the first place, because it's sometimes not always that. All day, every day in the clinician life, and this allow us to reconnect with patients, get together well and healthily with our teams, and have a sense of influence and autonomy in terms of what we craft and create and how it is that we practice. And we have a common instrument and idea exchange forum for us to be able to go and do together. And that's really what the essence of the project is.
That's wonderful. I'm so, with your experience, be able to create this resource for our physician community. It's something that's really needed, and I think it's something that the physician community is hungry for, with the burnout rates as being high as they are. And, you just hear so many docs saying, like, would I invite my kid to basically join the fraternity of physicians, and they're saying, no, they should go do something else. And that's heartbreaking to me, and I'm sure to you. So,
right. Yeah.
So amazing work that you're doing, and I want to thank you so much for coming on to the Doctor's Life podcast and sharing it with everybody. It's been such a pleasure speaking with you today.
Well, thank you so much, and always here to chat and talk. You're doing some amazing work yourself, and we're all in this together.
Agreed. Thank you, everybody, for listening to the podcast today. And until next time, I hope everyone stays happy and healthy. Take care.
You've been listening to the Doctor's Life podcast with Diane Ansari Wynn, MD. Go to www.dianeansari-win.com to read show notes, listen to past episodes, share your comments and show ideas, and pick up your free PDF and video of easy and proven strategies that will melt your daily stress away. That's www.dianneansari-winn.com.